What exactly is infertility? The problems with either conceiving a child or with carrying out the pregnancy to its eventual fruitful end fall under the definition of infertility. Infertility is the incapability of an individual to become pregnant, in case of females, or the incapability to induce pregnancy, in case of the males. The inability of an individual to carry out a pregnancy to its full term is also dubbed infertility. How does one recognize infertility? What are the signs of infertility? Signs of infertility are not always evident. Most people go through life without knowing there is a problem with their reproductive systems, attributing failed pregnancies to providence. In fact, miscarriages are the most common indicator of infertility. In women, the signs of infertility are more readily recognized as compared to men. Endometriosis causes the lining of the uterus to grow outside the uterus. Bacterial infections may begin around the uterus and spread to other reproductive organs, resulting in infertility. Fibroids in the uterus are indicative of infertility. Tumors in the cervix often cause stenosis, or narrowing of the cervix, which is a common indicator of infertility. Ovulating before the 10th day and after the 20th day of one's monthly cycle, premenstrual spotting, menopausal symptoms, etc. are indicative of luteal phase defect, and thus in turn are signs too. Irregular menstrual cycles are the most common indication in females that they might have some problems with fertility. However, an irregular menstrual cycle is not conclusive in itself, but it is definitely one of the signs of infertility. Issues regarding body weight are often indicators of being infertile. For a woman, being too thin, or anorexic, will definitely hinder pregnancy, since the body does not have the proper nutritional requirements, or the required strength. Alternatively, obesity can also be a sign. Obesity is accompanied by hormonal imbalance, which affects the reproductive system and pregnancy. Like females, in males too, either obesity or anorexia is an indication that he is infertile. Apart from these, anatomical defects may also be signs of infertility. Undescended testicles, or damage to scrotum and the gonads, are possible indicators too. Wearing tight undergarments, or exposing the testicles to heat, may render the person unable to produce the required number of sperms, or unable to produce sperms altogether, resulting in infertility. Determining the signs of infertility. There are many medical procedures for detecting the signs that help to determine whether an individual is infertile or not. Doctors usually prescribe one or more of the following medical tests. Electroencephalography. A dye injected into the vagina is monitored to check for blockage in the fallopian tubes or uterus. Laparoscopy. If disease and other physical problems are present in the ovaries, fallopian tubes, or in the uterus, infertility is suggested. This may be detected through laparoscopy. Infertility is a problem which can be solved if it is addressed in the holistic way, which is, using a multifaceted method of healing. Getting regular health checkups, taking supplements to combat existing problem, exercising and stress reduction techniques are only part of the holistic solution to infertility. The holistic approach is not only a surefire way to increase your chances of conception, it also guarantees a safe and healthy pregnancy. Click the link in the description for additional information about Pregnancy Miracle.